Good morning, everybody. I want to now start the demonstration with my colleague Adrian, but I also want to acknowledge here that this is the result of the work of a very large team. As Matteo said, 16 partners and a few persons in each of those companies and institutions. So I'm privileged to show the results, but it's really the work of a very large group. Second remark is that what you will see here is really the tip of the iceberg. You will see a smartphone screen basically and a computer screen, but back in the back there is a lot. There is a security, obviously. There is a standards, converters, identification mechanism, authentication mechanisms. There are translation systems. So there is really a lot behind this. What you will see. So what you will see is summarized in this global picture. The first part will be just this one. It's the Smart EHR used by a citizen in complete autonomy. So at this point, there is no connection to whatever. It's all local. My data is stored on my smartphone. Of course, we have backup mechanisms, but basically, I can start using my Smart EHR and store my data under my own control on my smartphone, and I'm in full control. When we say Smart EHR, it refers to smartphone EHR. In the future, of course, there's going to be advanced features, but basically, this type of EHR is sometimes called a personal health record or a patient health record. I will show you one example, which is based on the Andaman 7 application, which is the software that we've been working on in our company. And we are extending this software to use the protocols and features developed as part of the InteropEHRate project. If you want to take a look at Andaman 7, you can search for it on the Apple Store or on the Android Google Play Store and use those software. It's free for patients. So the first part is this one. So we are going to show you what a basic use of an electronic health record on a smartphone can be. So here you see, for example, that I have it's me on the first line, and then I have my 3 children at the bottom. So I have on my smartphone my health data, including the health data of my children. And I also have a demo record there in the middle. And I will now quickly show you what it looks like. So initially, sorry, oops. I don't know why it's starting from 0, maybe because I click on the wrong locations. Sorry, I will start the demo again. So what you have is, let me try to get there. Voila, here you can see that there is a number of sections with documents, with drugs that I'm taking, allergies. Initially, it looks very simple, and we wanted to make it look very simple for the patients. I'm sorry, it doesn't work anymore. It was working during the practice. So Tino, can I suggest that you take over the control and you click, you pause and play when I tell you so. So let's catch up on this, right? Keep it going. Okay, this is the global view. This is the first view of a basic view of the patient. You can let it run. And then I will go into a more detailed view of another patient here, Adam Spola. Now you can pause. You can see here that it can be extremely large. So for example, here we are in the allergy sections, and I have the allergies of the person, of Paula, but also refuted allergies and also family allergies. So it could be quite complete. So you can play. Besides allergies, which are an important part of the health record, obviously, there are other elements. Here I will show you another section, which is the document sections, and you can see here that there could be images like this one, of course, limited with the storage of the phone, but this shows that it can work, and you can see also that there is documents, letters, it could be PDF, basically any type of document can be stored in your Smart EHR system, ready for you to be used or to be shared with another doctor and so on. Here we're going in the body measurement element where you can enter your weight, your size, and all kinds of biometric values. You can see here there's a long list of elements to add. And you can see also here that you have various elements for better view of your data. But also here you see the whole history with lots of values. And if I click on one, you can see in the middle Withings, which is the brand of a scale, automatic scale. So this shows you that data can come automatically in your health record from connected devices. Blood test with various kinds of results. Here it could be documents, which can just be read by a human usually, or it can be structured data. So we try to provide a high or low quality of data depending on where it's coming from. Here you have the medication list that this patient is taking, and I click on this to see what is my schedule for today. So I was supposed to take the cetirizine in the morning. I click to mention that I took it. And all of that data about the drugs I took can be then sent to my doctor almost in real time. There is a small logbook also for patients to enter data over the course of their life. And so that can be reviewed by doctors if the patients agree to share the data with the doctors. Here you have notifications saying that new data has arrived coming from your hospital, for example, or from the lab. And to finish, here is a list of external services that could be added to, that are added actually. So you can connect to your lab, your hospital, you can order medication online. If you want to contribute to research, you can find clinical trial, as you can see here. This got a bit fast, but I don't want to go into the details of all of this because this is just a global presentation of the application. So with this, we are concluding, I believe, the first part of the presentation.